10 early warning signs of heart disease you should never ignore. Many people believe the first sign of heart disease is a sudden crushing chest pain, but in reality, it often doesn't begin that way. Your body may send subtle warning signals weeks, or even months, before a serious problem occurs, and they're easy to dismiss as stress, fatigue, or simply getting older. Before we begin, it's important to remember that this video is for educational purposes only. It is not intended to replace professional medical advice, an examination, or a personal diagnosis. Your heart is remarkably resilient. When changes happen gradually, it can adapt and keep working for quite some time. That's why early symptoms often go unnoticed. A little more tired than usual, slightly out of breath, needing more rest than before. These small changes may seem harmless on their own, but together they can tell an important story. Heart disease remains one of the leading causes of death worldwide. The good news is that recognizing potential warning signs early and seeking medical advice can make a significant difference. Keep in mind that experiencing one symptom alone doesn't necessarily mean you have heart disease. The key is paying attention to new, persistent, or unexplained changes in how you feel. In this video, we'll explore 10 early warning signs that many people overlook. And one of the symptoms we'll cover later may surprise you, because most people would never think to connect it with their heart. Let's start with one of the most common warning signs, and one of the easiest to ignore. Number 1. Unusual fatigue. Everyone feels tired from time to time. Needing rest after a long and busy day is completely normal. But if you feel unusually drained for days, even after getting enough sleep, and it is something you have never experienced before, it may be different. Some people describe it by saying, "I just don't have the energy I used to." Even when they wake up in the morning, they do not feel refreshed. A short walk, a trip to the grocery store, or simple household chores suddenly become much more exhausting than expected. There can be many reasons for this. Anemia, thyroid disorders, sleep problems, and other health conditions can all cause similar symptoms. But in some people, it may also be related to the heart no longer pumping blood through the body as efficiently as it should. When the body's tissues do not receive enough oxygen, energy production can be affected, leaving a person feeling constantly worn out. 70-year-old Robert first noticed this during his morning walks. He had followed the same route for years, but over the past few weeks he found himself stopping several times to rest. At first he blamed the weather. Then he realized the same thing was happening even on cool days. That was when he recognized it as a change that was not normal for him and decided to speak with his doctor. The symptom alone did not provide a diagnosis, but it did lead to a more thorough evaluation. Most people do not pay much attention to fatigue because it seems like a normal part of modern life. Yet sometimes the body gives its very first warning in a voice this quiet. Fatigue alone does not always mean there is a serious illness. But if it is new, becoming more noticeable, or appearing along with other symptoms, it may be worth taking seriously. The next warning sign is another change that many people simply blame on getting older. This time, though, the issue is not energy, it is breathing. Number 2. Shortness of breath. It is normal to become a little out of breath when climbing stairs. It is also expected that your breathing will speed up after a brisk walk. But if activities that used to feel easy suddenly leave you short of breath, that may be a change worth paying attention to. The heart delivers oxygen-rich blood throughout the body. With certain heart conditions, it may no longer perform that job as effectively as before. As a result, a person may become winded much sooner than usual, even during a short walk, while climbing a gentle hill or simply moving around the house. Some people say, "I can't seem to take a deep breath." Others say, "I just can't walk as comfortably as I used to." Of course, heart problems are not the only cause of shortness of breath. Lung disease, asthma, excess weight, or poor physical fitness can also produce similar symptoms. That is why it is important to consider how the symptoms began and how they change over time. After retiring, Linda walked her grandchild to school every morning. Within a few weeks, she noticed that she became short of breath while talking, even though the distance had not changed. At first, she blamed it on not exercising enough. But when the problem gradually became more obvious, she spoke with her doctor. What stood out was not how severe the shortness of breath was. It was that it was a completely new change for her. Sometimes the most important clue is not how dramatic a symptom is. It is simply that it is new for you. If your body is showing you a change you are not used to, it is important to find out why. So far, we have looked at 2 symptoms. Both are often dismissed as normal parts of everyday life. But the next warning sign may be even more familiar, and yet it is one of the most misunderstood symptoms of all. Many people believe a heart problem must begin with sudden, unbearable pain. In reality, some symptoms are much milder. That is why they are often mistaken for muscle pain, indigestion, or simple fatigue. For exactly that reason, the next symptom is considered one of the most commonly overlooked early warning signs. Number 3. Pressure, tightness, or discomfort in the chest. Heart-related chest discomfort does not always feel like a sharp pain. Some people describe pressure, fullness, burning, or tightness in the center of the chest. Others say it feels as if a heavy weight has been placed on their chest. The sensation may last for several minutes, ease with rest, and then return later. If it happens while walking, climbing stairs, or during physical activity, healthcare professionals consider that an important detail. Even so, this symptom alone is not enough to say that someone has heart disease. There are many possible causes of chest discomfort. Muscle strain, stomach acid, acid reflux, lung conditions, and even periods of intense anxiety can create similar sensations. That is why what matters is not only that the discomfort exists, but also how it started, how long it lasts, and under what circumstances it appears. 72-year-old James had been noticing a mild pressure in his chest while working in his garden for several weeks. It would go away when he rested, then return the next day. At first, he thought he had simply strained his muscles while using a shovel. But when the same feeling began appearing at other times as well, he realized it was not normal for him and talked with his doctor. What mattered was not how intense the discomfort was. It was that this was something entirely new. Sometimes the body does not raise the alarm loudly. Sometimes it whispers. That is why mild symptoms should not automatically be dismissed as unimportant. Although chest discomfort is the best-known warning sign, the heart does not always send its signals through the chest. Some people first notice pain in completely different parts of the body. Number 4. Pain that spreads to the neck, jaw, shoulder, or arm. Heart-related discomfort can sometimes spread to other areas without causing obvious chest pain. The most commonly affected areas are the left arm, the shoulder, the neck, the jaw, and sometimes the back. This happens because certain nerve signals from the heart can be interpreted by the brain as if they are coming from other parts of the body. This is known as referred pain. The pain is not always severe. Some people simply notice an unexplained heaviness in the shoulder. Others describe a mild pressure in the jaw. Some even visit a dentist because they believe the problem is coming from their teeth. For several weeks, Margaret appeared perfectly healthy, but after her evening walks, she began noticing a mild ache in her neck and jaw. At first, she thought it was coming from tight neck muscles. She tried massage therapy and got some rest, but the discomfort continued to return from time to time. Eventually, after talking with her doctor, it was decided that her symptoms should be evaluated more thoroughly. Of course, the most common causes of neck and shoulder pain are problems involving the muscles and joints. Poor posture, lifting heavy objects, or spending long hours at a computer can all produce similar complaints. But pain that appears in a way that is unusual for you, especially if it seems related to physical activity, may deserve medical evaluation. Most people focus only on the chest, but sometimes the heart sends its message somewhere else. The next symptom is something most people never connect with the heart. In fact, many assume it is only related to the digestive system. Number 5. Nausea, indigestion, or stomach discomfort. Almost everyone who experiences heartburn or indigestion assumes it is related to food. Most of the time, it is. But in some cases, discomfort in the upper stomach can produce symptoms that may be confused with heart-related problems. A person may feel a burning sensation below the chest, experience nausea, or notice an unexplained feeling of fullness. This can sometimes be more noticeable in women and in older adults. Focusing only on stomach symptoms can make it harder to see the bigger picture. Richard first noticed it during a family dinner. After eating as usual, he felt an unfamiliar pressure in his stomach. He assumed it was just simple indigestion. But when the same sensation began returning on different days, even when it had nothing to do with eating, he decided to see his doctor. The evaluation made it possible to investigate the cause of his symptoms more thoroughly. The important point is not to assume that every stomach problem is related to the heart. Most stomach complaints are caused by digestive issues. But if the symptoms are new, unusual, or appear together with other complaints, it may be helpful to discuss them with a healthcare professional. Early signs of heart disease sometimes appear one at a time. Other times, several small changes begin showing up during the same period. That is why looking at the body's subtle signals together is often more meaningful than focusing on just one symptom. The first 5 symptoms we have discussed are among the early warning signs people misinterpret most often. But the signs we will cover in the second half can be even quieter. One of the next warning signs, in particular, is something many people ignore for years because they assume it is simply a normal part of getting older. The symptoms we have discussed so far all share one thing in common. Most of them can seem like ordinary parts of everyday life. People often blame them on aging, a busy day, or a temporary problem. But sometimes the heart sends much more subtle signals. While these symptoms alone do not necessarily point to a specific condition, they can become much more meaningful when they appear together. Number 6, swelling in the feet, ankles, or legs. Many people notice that their shoes feel a little tighter by the end of the day. Standing for long periods, hot weather, or long trips can all cause temporary swelling. But swelling that is new and gradually becomes more noticeable may have a different cause. When the heart is not working efficiently enough, the body's fluid balance can be affected. As a result, fluid may build up in the ankles, feet, and sometimes the lower legs. Some people notice that their rings feel tighter than usual, or that their socks leave deeper marks on their skin at the end of the day. 74-year-old Barbara first noticed it while taking off her shoes one evening. Shoes that had always fit comfortably had started feeling tight over the past few weeks. At first, she blamed the warm weather. But when the swelling continued even after the temperatures changed, she decided to mention it to her doctor. Heart problems are not the most common cause of swelling. Kidney disease, vein disorders, certain medications, and many other health conditions can produce similar symptoms. That is why what matters most is whether the change is new and how it progresses over time. Quiet signals like these may not seem important on their own, but when they begin appearing alongside other symptoms, they can paint a much more meaningful picture. Number 7, dizziness or feeling like you might faint. Feeling briefly dizzy after standing up too quickly is very common, but frequent dizziness with no obvious cause or feeling as though you are about to faint may be linked to a variety of health conditions. Certain changes in the heart's rhythm, or a heart that is not pumping blood effectively enough, can temporarily reduce blood flow to the brain. When that happens, a person may feel lightheaded, lose their balance, or notice that their vision starts to fade or go dark. George experienced this while shopping at the grocery store. Suddenly, he felt lightheaded and had to hold onto the shelves for a few seconds. Since he felt completely normal again a few minutes later, he did not think much about it. But after the same thing happened several more times, he realized it might not be a coincidence and scheduled a medical checkup. There are many possible causes of dizziness. Dehydration, low blood pressure, inner ear problems, and certain medications can all produce similar symptoms. That is why this symptom alone does not point to any one condition. But if it keeps happening or appears together with other symptoms, it may be worth getting evaluated. Now let's move on to the next warning sign. This is one that many people dismiss by saying, "I was just excited," or "I probably had too much coffee." Number 8, heart palpitations or an irregular heartbeat. Under normal circumstances, most people are not aware of their heartbeat, but sometimes the heart may feel as though it is beating very fast, very hard, or irregularly. Some people describe it as a fluttering sensation in the chest. Others say it feels as though the heart skips a beat. Brief episodes of palpitations can be related to stress, intense exercise, caffeine, or certain medications. That is why not every episode of palpitations is a sign of a serious health problem. But palpitations that are new happen frequently or occur along with symptoms such as shortness of breath, dizziness, or chest discomfort may be worth discussing with a healthcare professional. Susan first noticed her heart beating irregularly for a few seconds while she was watching television one evening. At first, she thought it was caused by coffee, but when it happened again on different days, she decided to tell her doctor about the change she had noticed. Changes in heart rhythm are not always dangerous. In fact, many people experience brief palpitations from time to time. What matters is whether the sensation is new for you, becoming more frequent, or appearing together with other symptoms. So far, we have looked at 8 early warning signs. You may have noticed that most of them do not point to a specific disease on their own. What matters most is when your body begins showing changes that are unusual for you. In the final section, we will cover the last two warning signs. One of them may be far more unexpected than most people realize, because many never associate it with heart disease. We will also summarize how all of these symptoms should be considered together. So far, we have reviewed 8 early warning signs together. Perhaps the most striking thing is that most of these symptoms do not, by themselves, mean someone has heart disease. But if you begin noticing changes that have never happened before, and they gradually become more noticeable over time, it is important not to ignore them. Now let's move on to the final 2 signs on the list. One of them is among the warning signs most often overlooked, because people rarely connect it with the heart. Number 9. Cold sweats. Sweating on a hot day or during exercise is completely normal. But suddenly breaking out in a cold, clammy sweat for no obvious reason may be related to a variety of health conditions. Some people describe it by saying, "Out of nowhere, I was drenched in a cold sweat." When the heart is not working effectively enough, the body can respond as though it is under severe stress. As a result, a person may begin sweating heavily even while sitting in a cool room. This can sometimes happen along with chest discomfort, shortness of breath, dizziness, or nausea. 80-year-old William was watching television when he suddenly broke out in a cold sweat. The room temperature was comfortable, and he had not been doing any physical activity. At first, he assumed it would pass. But when he soon began feeling unusually weak, he decided to seek medical care. Of course, cold sweats are not caused only by heart problems. Low blood sugar, infections, certain medications, and many other health conditions can also produce similar symptoms. But when cold sweats appear together with other warning signs, they may deserve prompt medical evaluation. Our final warning sign is something many people assume is simply a normal part of getting older. But in some cases, it can be an important message from the body. Number 10. A noticeable decline in your ability to perform everyday activities. People often have difficulty noticing a loss of physical ability because it happens gradually. Stairs that were easy to climb a year ago suddenly feel exhausting. Carrying a few grocery bags takes much more effort than it used to. Even short walks require frequent stops to rest. Many people simply think, "I'm getting older." And it is true that physical ability naturally changes with age. But a clear decline in endurance over a period of weeks or months may sometimes deserve a closer medical evaluation. Helen first noticed it while taking care of the flowers in her garden. She had been doing the same tasks for years. But over the past few months, she found herself needing to rest after only a few minutes of work. At first, she blamed it on her age. But when shortness of breath and unusual fatigue appeared during the same period, she decided to speak with her doctor. What caught her attention was not one symptom by itself, but several small changes happening at the same time. If there's one message we hope you take away from this video, it's this: heart disease doesn't always announce itself with one dramatic symptom. More often, it begins with small, subtle changes that are easy to brush aside. Feeling unusually tired, getting out of breath more easily than before, noticing pressure in your chest, swelling in your legs or feet, or finding that everyday activities suddenly feel more exhausting. None of these symptoms alone can diagnose heart disease. But when several of them appear together or gradually become more noticeable, it's worth talking to a healthcare professional. That said, some symptoms should never be ignored. If you experience severe chest pain or pressure, significant difficulty breathing, sudden fainting, trouble speaking, or chest discomfort that spreads to your arm, jaw, shoulder, or back, seek emergency medical care immediately. If you're in the United States, call 911 right away. Getting treatment as quickly as possible can save your life. As we've seen throughout this video, the heart often sends quiet signals long before a serious event occurs. These changes rarely happen overnight. They usually develop slowly, making them easy to overlook or blame on stress, aging, or a busy life. That's why paying attention to what's normal for your body and noticing when something changes is one of the best ways to take care of your health. It's also worth remembering what we mentioned at the beginning. Heart and blood vessel diseases remain among the leading causes of death worldwide. That doesn't mean every symptom points to a serious heart condition. It simply reminds us why listening to our bodies and seeking medical advice when something doesn't feel right is so important. Now we'd love to hear from you. Was there one warning sign in this video that surprised you the most? Have you ever experienced any of these symptoms, or was this the first time you learned they could be related to heart health? Share your thoughts or experiences in the comments below. Your story could encourage someone else to recognize the signs and seek help sooner. If you found this video helpful, please consider sharing it with your family and friends. Raising awareness about heart health could make a real difference in someone's life. And if you'd like more clear, trustworthy, and easy-to-understand health information, don't forget to subscribe to the channel. Thank you so much for watching. Take care of yourself, stay well, and we'll see you in the next video.